Maine is one of just 5 states in the nation without a medical school that grants the MD degree.
It isn't for lack of trying. In 1977, the legislature backed a plan for a medical school at the University of Maine, but it was vetoed by then Governor James Longley.
Now, however, there's a new effort to train the next generation of doctors in our state. News Center Maine's Donovan Lynch reports.
The state of Maine is one step closer to launching its first medical school granting the title of MD. The legislature approved funding Tuesday for a feasibility study to figure out whether this plan can become a reality.
Next decade, possibly. Sooner than that, I don't think so. But I think we are actually farther along than most people think.
But what goes into building a medical school? University of Maine President Joan Farini Mundy says a strong home institution is critical.
A medical school, or an environment in which we're very concerned with the preparation of healthcare professionals, benefits greatly from the research that goes on at the institution.
While many of the specifics are still up in the air, we know one thing for sure. The medical school would be in Penobscot County. Senator Joe Baldacci wrote that into the bill calling for a feasibility study. He says the location of the school would have a large impact on the region.
Having a medical school will help our children, will help our grandchildren, will help the future of northern Maine and eastern Maine. It will help the future of our community.
Rural areas across the state are struggling with a shortage of healthcare professionals. That's one reason Dr. James Jarvis of Northern Light Eastern Maine Medical Center hopes the school will cater to the needs of the area.
There are Mainers in our more rural communities who really have just not had access to both healthcare and the experience of being able to be part of education of healthcare. And so having a school in Penobscot County may help to expand that.
There is some resistance to the plan. Faculty at the University of New England College of Osteopathic Medicine, which awards the slightly different DO degree, say graduating more doctors won't solve the bigger issue.
More medical students into the pipeline without addressing the problem of third-year clerkships and residencies just means we're going to send more students out of the state.
The feasibility study will cost about $125,000, and the results won't be published until 2025. In Orono, Donovan Lynch, News Center, Maine.
Dr. James Jarvis with Northern Light Health says if the state does move forward with establishing a medical school offering MD degrees, it would likely be several years before it welcomes its first students.